Welcome back, everyone. I'm sitting here with Lupe Cruz from LDS Hospital, and it is Cervical Cancer Awareness Month, which also brings up the topic of a vaccine and a virus, actually called the HPV virus, that we're talking about today. So tell us what the virus is.
So the virus is, it's a virus, so there is no cure for it. It is skin-to-skin contact, sexually transmitted. It can be oral, vaginal, cervical actually, cervical, anal, in the throat. So it's, you know, can be in several different places, and so that's what we have that vaccine for.
Okay, so how would you know if you have been affected, if you have HPV? What are the signs?
That's one of the problems. So a lot of people, most people who get that don't even have symptoms. They don't know that they have it. Their body could have it, and then their body recovers from it, or their body fights it. Just like any virus, your body's going to fight it. So there are about 100 different, over 100 different types. There are about 40, 50 that affect the cervix, and about 15 that could lead to cervical cancer. And because it takes so long to develop, sometimes 20 years to actually become cervical cancer, then, you know, we don't see any signs and symptoms of it.
Okay, and so the only way to prevent it is to get the vaccine and get it done beforehand, right?
Right, so the best way to make this vaccine the most effective is to get it before the person becomes sexually active. And now it's not 100%. Just because you get the vaccine does not mean that you will never get HPV. It just helps. It kind of reduces your risk.
Okay, so who should get this vaccine?
It is recommended that boys and girls get it anywhere between the age of 9 and 26. If they get it before,
young age,
yeah. If they get it before 15, there's 2 vaccines within 6 months, and afterwards there would be 3.
Wow. I want to just really quickly note, like, this can lead to cervical cancer, which is why we're talking about it. But nearly 13,000 women in the United States are diagnosed with cervical cancer each year. But that's why you guys are offering this vaccine, is to prevent this HPV from developing.
Right. And another
worse, right?
Right, and another thing that you want to do is, once a person becomes 21, a woman becomes 21 years old, then we start screening for cervical cancer and cervical changes and HPV, and that would be with the Pap smear.
I just want to go over this too. Condoms do not protect against it.
Right.
The risk of exposure increases with the number of partners you have. 75 to 80% of sexually active adults will acquire it before the age of 50, and most occurring between the ages of 15 to 25 years of age. Yeah, this is a tricky virus, right?
It is.
And a little controversial. I think that a lot of people are kind of wondering, do I get my 13-year-old, you know, this vaccination? Is that promoting, you know, being sexually active?
It's not really, I don't believe that it's promoting. I think it's a protective thing. It is protecting that person for when they get older, because you don't know who their partners are going to be, if they've been exposed, or even how many partners that they're going to have. There's no way to control that in your children as they get older and they become young adults. Then it becomes their choice. But if you help protect them when they're younger, you're helping them, you're doing them a service.
Well, and I think an interesting thing that not a lot of people talk about is boys are affected by this.
Yes,
we kind of slip over the fact that it's something boys should get done as well, right?
Right, and there isn't a screening for boys for the HPV virus, so just for the females.
Good information, and so important to be informed on this, and the LDS Hospital has all the information and more on that, and there is their website right there on the screen. Lupe, thank you. Good conversation, good topic.